Hello, my name is Ewart Johnstone, and I'm a dentist working in Gwauncagowan dental practice. And I'm going to give a brief presentation on our reflections about practice reform, and we'll consider the opportunities and challenges of working in a non-UDA system. Now, I work in Gwauncagowan dental practice. We're a modern five-surgery practice situated in the upper Swansea Valley, just below the Brecon Beacons. The practice has been established for over 30 years, and prior to COVID, we were involved with practice reform and the principles of shared decision making, looking at data, skill mix, and reducing our reliance on UDAs with our teams and our patients. Now, the practice, as I said, Gwauncagowan is an area that can be considered an area of slight deprivation. We are just, as I said, below the Brecon Beacons, close to Ammanford and near Pontardawe. We always advise practice teams to look at the Welsh Index of Multiple Deprivation to work out what the clinical need is for their area. And our area, we have a high incidence of dental caries and also periodontal disease. So the practice, as I said, prior to COVID, we were using the principles of practice reform. We were using the patient oral risk and need assessment tool, or ACORN. We'd certainly adopted the principles for team development and the appropriate use of skill mix. We had not moved to a complete non-UDA working. We were working so that 80% of our contract was still a UDA requirement. But we had certainly adopted the principles of learning from data as a practice, as I'll show you in some coming slides. We are heavily reliant on our team. So our team of 5 dentists, hygienists, and clinical dental nurses. And I say clinical dental nurses because of all of our dental nurses have additional duty and skill mix use, which I will go on to in a second. So we have a process for using ACORN, so assessing our patient's clinical risk and need. We'd adopted that some time ago, so we did use some assessment tools prior to ACORN. So the team, the dental nurses, receptionists, we're all fully engaged with looking at our patients and putting patient-centered dentistry, looking at timely, effective, achievable needs for our patients. So I mentioned skill mix. The practice has been utilizing our team for over 5 years by getting them to do some extended duties. All of our dental nurses, that's 8 dental nurses, all have extended duties from fluoride varnish application, removal of sutures, radiography. They can take radiographs on our patients. They can do impression taking on the patients. But they all collect their own data and report back on a monthly basis to the team. So we can show that A, they're being utilized, and B, whether what they're doing allows us as dental clinicians to do some additional duties, skills, etc. So you can see we have some run charts from one of our DCPs here. This is one of our DCPs. And remember, 8 of the DCPs are doing this, and they all have their own data. So you can see on this run chart, I'll just get my mouse to work here. So you can see where the dental nurse is doing her extended duties, and then here's the effect of COVID on the use of extended duties for the dental nurse, where COVID, in effect, ceased their extended duty use. However, post-COVID, you can see the run chart completing post-COVID, then the extended duty use has increased, and you'll probably find as the data comes in, we're using their skill more than we used to. But this just shows that the practice utilizes data and the understanding of data. And that's important during COVID when you're considering expectations for fluoride varnish application in children and adults and also new patients seen. But if we go on to practice reform, data will still be very important for some of the key performance indicators for practices. So COVID hit, and it certainly affected the practice. During that time, we sat as a practice and we thought about the future. We thought about communication tools to use with the team, and our team was scattered. We were working in different teams within the practice to reduce the risk of COVID. So we thought that communication between the different teams was vital. So we will be providing up-to-date bulletins via WhatsApp or other social media tools for all members of the teams to show how we were doing with expectations during the COVID. And those expectations were to do with new patients seen, fluoride rate applications in adults and children. And you can see from this small little bulletin, this is probably from last year, how we're showing the team what we're expected to do, how we're doing, and giving them a G'ing up exercise. Now we're now moving towards an endemic or a post-COVID era, hopefully. So we're now thinking about the future, and there certainly will be a future for our practice and our teams, and that future will be based, or very heavily based, on practice reform. Now, with practice reform, we have to consider naturally our patients. We're looking for patient-centered care, but patients are expecting different things nowadays as well. So we want to influence our patients for behavioural change. We want to be making sure that we're adopting the principles of preventative dentistry by providing our patients with good information on oral hygiene and caries risk. We've also got to consider that our patients also have influences on them. So our practice and our team have to develop as patients' understanding of dentistry and what it can offer also changes. All medical practices, and I say medical practices, that's dentistry, pharmacy, doctor surgeries, are all affected by staffing issues. There are staffing issues throughout the UK, and as a practice, we have to be aware of that, and we have to make sure that we have appropriately trained staff to maintain and develop our practice. And then the final key part that cannot be forgotten is the funding stream. So again, as a practice, we are fully aware that we have to be funded, and we await the funding stream that goes along with the principles for dental practice reform. Thank you very much. If you have any questions, I can be contacted, and the email address will be shown at a later date.